Topic today, I think the topic name really says it all. We are going to talk about the pay scale for pharmacy technicians. And, you know, I really wanted to talk about what I deem as the elephant in the room. And before I start a topic and kind of confirm that's what I'll talk about, I do a little bit of research because I want to make sure that this is a topic that not only is of relevance to me, but is of relevance with the general pharmacy technician population. So what we'll do first of all is I'll show you some survey findings that I came across when I did my research. We'll look at those survey findings, and the neat thing about these surveys is that they are very recent surveys. So we'll look at those, and then we'll go into some historical data on possibly where the pharmacy technician pay scale came from. Why is there that great kind of diversity between the pharmacy technician pay and the pharmacist pay? We know some of the reasons, right? But we'll delve into that a little bit. And then what I want to do is really have you walk away today with some tools to go back to your pharmacy and to address the pay scale there and to really hopefully make a difference in what you're seeing with your pay scale and with the other pharmacy technicians' pay scale. So what we're talking about today, in my opinion, is really the $1 million job that we're doing as pharmacy technicians, a $1 million job for just a minimum wage paycheck. So let's take a look at the first survey. This is a survey conducted by PTCB, Pharmacy Technician Certification Board, and again, a recent survey in 2022. COVID brought about many things, many changes, and one of those things are surveys. The pharmacy profession had a lot of surveys put on us because of the, general sentiment of the workforce. So a recent survey, PTCB entitled it Job Satisfaction Survey. There were 20,000 pharmacy technicians who answered this survey. So these results are based on 20,000 responses. And one of the questions was, how satisfied are you with your job as a pharmacy technician? And half of the people said they're very satisfied. So that means that half of the pharmacy technicians are not satisfied. So why is this relevant? Why is this important? It's important because selfishly, we want to have a higher paycheck. But then we put the pieces together, and that we can see that when pharmacy technicians, or really anybody in their profession, isn't satisfied, they don't perform at the top level or a level they should be performing, and then they leave the profession and they seek something where they are going to be satisfied. So PTCB, how satisfied are you? About half of the respondents were satisfied. So 10,000 people are left unsatisfied. And the next question was, well, what could happen to help increase your satisfaction at work? And surprise, no surprise, higher pay. I have been involved in many discussions where the point about pharmacy technician pay was entered into the discussion and quickly overlooked because it is kind of an elephant in the room. It's something that doesn't get talked about. So the next survey I looked at is from the National Community Pharmacist Association. And again, this was a recent one. And it was entitled Community Pharmacy Economic Health Survey. Now, what I want you to know about this survey is these are independently owned community pharmacies, which make up about 1/3 of the community pharmacies in the United States. So these survey results are not from the big chain like the Walgreens and CVS. These are from independently owned. And so the owners, the managers at those pharmacies are saying, pharmacy technicians are in short supply. We know that, but we had these surveys to qualify it, right? So this was a survey where they sent out about 5,000 surveys online, and 340 came in with responses. So not a big result, but big enough to get some information from it. So 88% of these owners in these community pharmacies say that they're having a hard time finding pharmacy technicians. Next survey I looked at, State of Ohio, again, real recent, 2021. So why did I pick a State of Ohio survey to share with you? It's because there were over 2,500 responses. So over 2,500 technicians in Ohio responded to this survey, and it was called the Pharmacy Technician Workload Survey. I don't think we have technicians from many states. I think we have 25 states represented today, none of which reside in Ohio. But the reason I picked it, you'll see, because of the number of technicians who responded and because of what they said. So first of all, again, it's no surprise that short staff, and we need to have the pharmacy technicians there to promote patient safety. Are you satisfied? 62% of these 2,500 pharmacy technicians said, we are dissatisfied. We are dissatisfied with the pay that we have. Our pay scale is not where it should be. Now, the neat thing about this survey is that there was room for the technician to kind of write in freestyle responses. And so I have some of those to share with you. There were many, many responses, such as this, where technicians could just type in what they wanted to. So I just pulled 3 of these that really stuck out to me. I want to read a little bit of this one to you. Farm techs have the ability to give vaccinations, to do point of care testing, and to bill insurances. We are handling a lot of things that used to be pharmacist-only tasks. And so I just want you to hold on to that because we're going to talk about that in a little bit. We're doing a lot of things now that used to be pharmacist-only tasks. And then the rest, this individual says, we deserve to get pay that reflects what we're doing. This one right here, this person's dissatisfied, very candid. This person says it's disgusting. And what really stuck out at me is this job isn't a career, it's a punishment. It is sad, isn't it? This is the last one that I'm going to share with you, but I want to tell you, I didn't read all the comments. There were so many. So what does that tell me in the job that I have at the university, that when you see that people do more than click on, rate this from 1 to 5. You guys have all seen those. You're going to get those when you fill out these evaluations. When someone takes the time to write in comments, it means that this is very, very important to them. So what stood out on this comment is, it is hard to work at a job when I make less every year. And that's what we're seeing. The technicians may get a pay raise, but it's not enough to cover the cost of living increase. So in essence, they're making less each year. So now I need to hit this closer to home. So what you're seeing in the colors here is a Nebraska survey. And this is very recent. In fact, I think I just got an email probably yesterday about it, but the university, in partnership with Nebraska Pharmacists Association, designed a survey for pharmacy technicians in Nebraska. And there were, I think it was 490 pharmacy technicians who responded to the survey. So if you're one of those technicians who responded, thank you for doing that. And what I pulled out of the survey to share with you is the average hourly rate of pay in Nebraska. And I'm sharing this because I think we all have a little bit of a curiosity to see where we fall in line with other technicians. And this is of all different types of work settings, whether it's a hospital, community pharmacy, a PBM company. So what we see in Nebraska is that on average, technicians make anywhere from $15 an hour to $22 an hour, what we see in the green. That's on average. Now, some technicians make more, some make less, but that's the average that we see here. So when I did my research, I stepped just a little bit farther into social media. And I just admitted and told all of you, I am not on Facebook and I'm not on any social media, but I did check out Reddit. And I thought what I would see on Reddit, the reason I checked social media is because these are people who are not being asked to do a survey. These are people who are really free-forming it and giving their candid opinion. And so what I highlighted here in yellow, I can't afford to live on my own. Even with that, it isn't fair that we do a lot of the work and get paid a small amount. So these are really the sentiments that we're seeing in the pharmacy technician profession. And again, what stood out to me. And the next one, it troubles me, and I think it troubles me because it's so true. I think if I didn't think it was true, it wouldn't bother me, and I probably wouldn't even be sharing it with you. So this individual says they're making, well, I won't read that part. They're adding more and more to our workload with 0 raises. It's not worth what we're getting paid. The thing that made me finally leave where I was working is that they were training us to do flu vaccinations. If I'm not going to get paid to do that extra work, then why am I going to do it? So again, I want to hit home on why I'm here today to talk with you about the pay scale. And it's because pharmacy technicians are truly doing $1 million job, and the pay band isn't showing it. The pay band is not showing the work that we're putting in. So let's shift gears. I shared with you some survey results where I did my research, and now I'm convinced, yes, this is a hot topic. Yes, this needs to be addressed. Yes, it's somewhat of an elephant in the room. So now let's go and take a look at key historical factors. So early in the day, imagine a pharmacy, and the pharmacy was ran by Dad, and who helped Dad, but it was son or daughter who came in after school. And Dad's not going to pay son or daughter to help him. And then we're moving forward a little bit in time, and it's a family member, and then in the 1970s, that's when the pharmacy technician title first came about, and that kind of career role first came about. And even then, when you think about in the 1970s, technicians were strictly doing these assistant type things. It wasn't the responsibilities and the things that technicians do now. And so the pharmacist sentiment was really, I'm not going to pay this individual very much because really I could be doing all this work. They're just kind of helping me do a little bit of stuff that I could do on my own. I'm not going to pay them very much. Historically, education was not required for pharmacy technicians. Certification was not required when these pay scales were set. And the pay scales just have not adjusted to correlate with modern regulations and the modern time job duties of the pharmacy technician. So as we're enjoying our lunch, I hope you're enjoying it. I hope those of you at home are lunching. I know we're in different time zones, but I want to take a little time out and tell you a story about me. So I grew up on a farm, a very small community in Iowa, and I lived about 8 miles outside of town. And so where I want to place myself is in elementary school. I think I was in 5th grade, and across the section lived a teacher, Esther Severine. And Esther Severine called Mom one day and said, and wanted me to come over and help her do some housework. And trust me, I don't like doing housework, but I knew I wanted to please Esther Severine because Esther Severine was a teacher, and I was in 5th grade, so my life was about pleasing the teachers. So I went to Esther's house, and Esther brought me to her basement. And she said, Judy, I want you to scrub the floor. And I said, okay, and I probably smiled. And I will tell you, these hands had never scrubbed a floor in their life, but I was going to scrub that floor for Esther, and I was going to do it enthusiastically because I wanted to help her, I wanted to please her, and I wanted to do good. And so she gave me the things I needed, and I went about doing it. I didn't ask many questions. And a little while later, Esther and her husband, Walt, came down into the basement, and I heard them laughing at me. And Esther said, Judy, you have scrubbed yourself into a corner. And I had. My back was against the wall, and the only way I was going to get out of where I was to walk across my wet, clean floor. And I wonder if that is what we have done in the pharmacy technician profession in our character to enthusiastically please, enthusiastically help, and to want to be there for our pharmacists, to want to be there for our patients, if we have kind of painted ourselves into a corner. Yes, I will give vaccinations without asking, will I get paid more? Yes, I will start doing patient interviews without asking, how does that affect my schedule? I think that maybe we painted ourselves into a corner because of our nature to want to please, to want to help, to want to do good. And so now I think we're at a point where we painted ourselves into the corner, and the only way to get out is we're going to have to walk across that nicely painted floor or painted area, if you will, and then repaint it later and make it look good again, right? The pay rate for technicians has stayed static. It has not adjusted to the responsibilities that technicians now do. I started teaching in the pharmacy arena probably about 15 years ago. I know it's hard to believe because I look so young, but years and years ago, I can't even remember how long ago. Do you want to know who laughed the hardest at that? My husband, right there. So something that's been around forever since I started in education was it is hard to attract an individual to go to college or to have any schooling to be a pharmacy technician when they make the same as someone who works in the movie theater. This adage has been around as long as I've been in education. And why would someone do that? It takes a very special person to do that because they're not only going to pay to go to school, but they're going to go through the stress of testing and what school involves, and then they're going to get done, and they still get paid what the popcorn person gets paid at the theater. So here's what I'm here to ask you. Are we acting our wage? And I know the answer. I know we're not. I know we're acting way above our wage, and that's the way it should be. Bureau of Labor and Statistics says that there are 420,000 pharmacy technicians in the United States right now, and Bureau of Labor Statistics says that technicians are vital to the healthcare system, vital, yet paid on average just under $17 an hour. Some of us make more, some of us make a little bit less. That's on average. So why overextend myself? You heard one of the individuals who posted on Reddit. Why am I going to vaccinate if I'm not going to? Why overextend myself? So early on when COVID first hit us and the pharmacies were being hit really hard, there's a pharmacist from Oklahoma who came up with this hashtag the pizza is not working. She said, you know what, we're in the pharmacy. Our workload is very heavy because as with every workplace in COVID, people were out, they were out sick or they were out taking care of their relatives or loved ones who were sick, right? So we're short on workflow or on the workforce. We're putting in longer hours. We're doing more because we're giving these vaccinations. We're doing more. We're testing people for COVID. We're doing more, working more hours. And how we're being rewarded is once in a while, the pharmacy CEO will buy us a pizza for lunch. And this pharmacist says, hashtag the pizza's not working anymore. More than ever during COVID, so those of us who work in community retail pharmacies know that, most of the time the patients who are coming to see us are sick. And so I'm subjecting myself to that. But now during COVID, that's abundantly, something that we think about. This person's coming in, they're maybe infected. It's a more risk in our work environment, and how we're being rewarded is by pizza. The pizza's not working anymore. I think what it is about is it's about setting boundaries. Acting our wage isn't the answer. We have to act way above our pay rate because of the patients who are there, the patients who we are taking care of. So what I want to do now is share with you some very public ways that people have been trying to set boundaries. I don't watch the news anymore. I haven't watched the news for years. I kind of made that decision. I don't do it. My husband and I do something on Saturday mornings, Sunday mornings after church. We go to our reading nook and we look over our news feeds and we talk to each other about news feeds. If it's a nice day, we're outside doing it with our cup of coffee. So whether you get your news from news feeds or you listen to the radio or you watch the world news on TV, you guys have heard about the pharmacy strikes. So the first one was Kaiser, and that's West Coast. And this one was not just pharmacy specific. This was healthcare workers. And it was termed the largest healthcare worker walkout in U.S. history. And then that was soon followed by CVS walkout, and that hit closer to home for us here in Nebraska because this happened in Kansas City. And very recently, September, so just a couple of months ago. So the individual striking said in a nutshell, work requirements leave us unable to safely fill and verify scripts, putting patients at risk. So when we heard about these strikes, it really, it kind of affected us, didn't it? It affected our morale. What's going on with us? Are we doing the right things? You know, it really affects you because historically, healthcare workers do not strike. And certainly pharmacy staff do not strike. So this CVS strike then was followed by a Walgreens strike. Now, what stands out to me, or what stood out to me about the Walgreens strike, and again, this was in the Kansas City area, is that this was the first that I read it involved pharmacy technicians. So there were pharmacy technicians who had quotes in the articles that I read, and this was the first where it wasn't just pharmacist-centric, but where there were pharmacy technicians. So the ball is still rolling on this. We don't know if the strikes helped. These were individuals who picked a very public way to set boundaries. And we don't know. We'll have to see when the ball stops rolling, how does this turn out? We don't know yet. I did a little bit of research to try and find out, but it was two different opinions. The Walgreens CEO or Walgreens leadership said, we are addressing these issues. We are hiring, you can see right here, we're increasing salaries for the pharmacists to get better pharmacists, more pharmacists. We're doing this for the pharmacists. We are shortening hours to make the work environment better. And then on the other hand, I read information from the Walgreens employees who said nothing's different. There's been no change whatsoever. So this is another piece of information that probably hit me the hardest that I want to share with you. Give you something to think about maybe when you're driving home today, but just for a little bit because you've thought enough about pharmacy. So think about it for just a little bit. So ASHP, that's American Society Health System Pharmacists. It's an association, and even though it doesn't have pharmacy technician in the title, there are pharmacy technician members. And in fact, there are a lot of pharmacy technician members. American Society of Health System Pharmacists. So ASHP said, man, there is stuff going on. We need to get our feet on the ground. We need to investigate this. We need to put together a task force, and we need to get to the bottom of this and get some solutions. And so they put people on the ground, and they put people around, and they had this task force, and then they came up with the solutions report, which I think was just published very, very recently. And here are some things that they came up with to seek to improve workplace conditions by addressing day-to-day challenges and removing obstacles. They have 5 focus areas, and I'm here to tell you that not one of their focus areas is about increasing a technician rate of pay. But here's what they did say. They said that we need to make sure all of these technicians have uniform education. And I'm here to tell you that pharmacists do not have uniform education. You don't have uniform education unless everybody is going to the same college and being taught by the same professor. It doesn't happen. But that's one of the things they said. And look at the second bullet point. This is American Society Health System Pharmacists with pharmacy technician members. We are going to assign more complex duties to pharmacy technicians to make them feel valued. And again, now you guys read the report. Some of you got it. If you didn't, go to ASHP. It's probably really easy to access on their website. I read it quite a few times. I didn't see anything about pharmacy technician pay. Only things that we're going to start doing more of to help us feel better. And then that segued into a discussion about giving us more responsibility. Okay. And then the last bullet point on that side, we're going to leverage pharmacy technician responsibilities and technology and their efficiencies. They know we're efficient, so that the pharmacist can do more of that clinical patient care. And then on the other side, these were mentions of increasing the pharmacist pay by working with the state payers, which are like Medicaid, Medicare, the third-party payers, to kind of leverage the payment system to give a higher reimbursement to pharmacists, which I do not disagree with. But what bothers me is that there isn't information about technicians and looking at the well-being of technicians as far as the pay. I am here to tell you, I don't live under a rock, none of us do. What we are paid has something to do with our self-esteem. Yes, we help patients, and yes, that makes us feel good, and yes, we help our pharmacists, and yes, that makes us feel good, but what we get paid makes us feel good too. And that has to do with our satisfaction. So I think that the catalyst is there. I think you would agree. We've had a very big catalyst, the public strikes. The catalyst is there. A couple of other pieces of information here. Kansas Board of Pharmacy polled their pharmacists, and the pharmacist said they don't feel they can perform their job safely because there's not enough staff. And when they say enough staff, they mean there's not enough technicians. In California, 91% of the chain pharmacists just very recently said they lack the staff, they lack the technicians to have safe patient care. So all of the data is there. This is the problem. There's a shortage in pharmacy technician workforce. There's a shortage because technicians are dissatisfied, and they're dissatisfied because the rate of pay isn't where it should be. And so my solution that I propose is to adjust the rate of pay for the technicians. So if there's one thing that I've learned, it's that we just can't adjust the rate of pay. There's a whole system that has to kind of, a systematic thing that has to take place. So here's what I did. I thought, let's take a look. This isn't new to pharmacy technicians. There have been other professions that have had to do some type of a pay band adjustment. So according to Bureau of Labor Statistics, they are telling us that on average, technicians make about $37,700 a year. Now, some make more. In fact, the highest 10% make a little over $50,000, and then some make less. So this is on average. So I thought I'm going to compare the pay scales of pharmacy technicians to like or similar careers. So the first one I took a look at was LPNs. So licensed practical nurses assist nurses, technicians assist pharmacists. So I thought this was a good comparison. Looking at their median wage, they're sitting at, their average is higher than our highest. And their highest 10% earn upwards of the $70,000. And doesn't this seem similar? LPNs assist nurses. They must complete a state-approved education program. That's what we do here in Nebraska, and many other states do the same. It typically takes about a year, and they also have to have a license. There's only about 4 states that don't require a pharmacy technician license or registration. So a very similar comparison. The next one I thought I would take a look at is dental assistant. Pharmacy technicians assist pharmacists, dental assistants assist dentists. A little bit more in line, but still about $10,000 more a year that the dental assistants are making. And they can become a dental assistant by a number of different paths. Some states require that they go to college, some states don't. Some states say you have to pass an exam, very, very much just like pharmacy technician profession. Some states don't require any education, on-the-job training, and still their pay scale is that much higher than the technician. How about surgical technician? Assist the surgeon, pharma technician, assist the pharmacist. Look at their average pay is a lot higher than the technician's top 10%, and their top 10% is in the neighborhood of 95,000. Typically, they need a certificate. Sounds familiar? Typically, technicians need a certification. Employers may require or prefer that certification. Some states regulate the workers, some states don't. So this is information that is a catalyst. This is information that starts the adjustment of a pay band, is where there is the human resources department takes a look at what similar positions are making for pay. So when I want you to leave with a solution, I want you to leave with tools, right? And so I have a couple of aims with my solution. So the one aim is it has to be about human resources, the talent acquisition department, the employers, and the other is what we're going to do. So let's first of all take a look at that first aim, which is the employers. You have to get human resources to review the pharmacy technician job descriptions and make adjustments to the responsibilities that are now there. It has to get updated. Research-related job markets, which I just did for you, and I'm sure there are more. Those are just some that I came up with. And rank those positions according to the qualifications. And then when we do that, we can widen the pay band. So right now in Nebraska, I'll use that as an example, that pay band was $15 to I think it was $22 an hour. So we might still have that $15 down here, but it'll go up to $40 an hour. And that means when someone enters that profession, they might be entering at that $23 mark instead of the $15, because we are making the adjustments to the job descriptions. We need to develop and adjust the career ladders and career lattices. So a ladder, it used to be always we talked about a career ladder. I am a pharmacy technician 1. I'm going to take a step up to pharmacy technician 2 and get a pay raise. But now lattices are lateral movements. It's not so much I'm moving up, but I'm going to move over here and do this and get a pay raise because this also has more responsibility. I've been dispensing meds, now I'm going to help more with medication therapy management. It's a lateral move. And we have to adjust the qualifications of the position. Listen, folks, in Nebraska, individuals have to be certified. Has the pay scale adjusted to that? I think certification has been mandated now we were talking about that earlier, for 10 years. Have the pay scales adjusted to that qualification? So again, I thought this has happened to other professions. We hear about the strikes. We heard about, we're all, especially if you're me who likes to go to movies, we're very much aware of the writers' strike. It's kind of the same thing. The writers are saying we're pretty vital to these movies because there's no script unless we're writing it. But why are we not getting paid what these producers and movie stars are? And same thing with technicians. We're pretty vital. Yeah, we don't have the education that the pharmacist does, but we have education. We're pretty vital, so why are we getting paid down here? We don't have the responsibilities that the pharmacist does, but we have responsibilities, so why is there that diverse pay scale? Here's what hit home, though. Here's what made the most sense to me, because I have shared how I am deficit in everything social media. So public relations people, years ago, made between $35,000 and $50,000. That was their pay band. And then social media came about, and all of a sudden, we need people who know how to do the ad marketings, to put on Twitter and TikTok and all those other things I don't know about. And so because there was a need for a skill, right, these individuals had their pay band adjusted because there was a need for their skills. Doesn't that sound familiar? Isn't there a need for pharmacy technicians' vaccination skills? That's one of the good things COVID brought about, was that demand that brought the profession forward in tasks, but not in pay. So take a look at that. There's the skills now that are there, that are being used, that are part of the job responsibilities. So when we're adjusting those job descriptions to help with the pay band adjustment, we're going to look at the pharmacy technician's experience, their level of education, their certifications. Folks, there's more than certification. There is certification in vaccination. There's certification in payer reimbursement. There's certification in medication therapy management. So there's all these different certifications and endorsements that can add to your credibility. I talked about it earlier with Becca. You can be a delegate, and that adds to your assets in your resume to help get your pay up. So look at that. Geographic location, we have to look at that. In Nebraska, we are not going to get paid what a technician in New York City gets paid. It's just, you have to look at the geography of it too. The job responsibilities, and I propose that we look at the volume in what we're running in the pharmacy. If I am working at a pharmacy at the corner of nowhere and somewhere, and I do 500 scripts a day, and the pharmacy across the street runs 200 scripts a day, the technician at the 500 scripts a day should get paid more because they're hustling faster, and they should be able to share in that revenue that's coming into the pharmacy because they're part of the revenue maker. So I really propose that we need to look at the volume and also the risk of the job. If you're handling hazardous drugs, you should get paid more. If there's more of a risk with the job, the pay should be there too. So now I look at my second aim, which is us to set boundaries. I talked a little bit about the public boundaries with the strikes. I'm not in any way, shape, or form saying to do that. I'm just kind of talking to you about how people set boundaries, and I think we need to do that. We always need to do our job well. Everybody has a bad day. We always have to do our job well because we're front-facing with our patients, and our patients are us. We are our patients, right? Our patients are our family. They are our friends. So always do our job well. I've always told my students to consider other forms of compensation other than the salary. For example, there's a lot to be said for a job where you can work from 9 to 3 if you're a mom who wants to take your kids to school in the morning, drop them off, I go to work, clock out at 3, and I pick my kids up from school. There's a lot of value in that, and for all you young moms, there's a lot of value in that. There really is. Non-financial rewards such as education. I know, at least I think I know Nebraska Medicine has, is it $5,000 a year that they give for education, and make sure that that's education that is not education to learn how to vaccinate, but it's education maybe on a more personal note to you of, hey, I like being a pharmacy technician, but I really want to be maybe a respiratory therapist. So it's any kind of education that you want to get, that they'll help reimburse you for that. I have 7 daughters, and I tell them this often, and probably not often enough, know your importance. Know your importance as a pharmacy technician professionally, know your importance as an individual, know your importance. When you are setting boundaries, know your importance. I can't tell you, I can imagine, but I can't tell you what a bad day that pharmacist is going to have when not one technician shows up to work, right? Know your importance with the work you do. And let your boss know, whether it be a pharmacist or supervisor, whoever your boss is, if you feel overlooked or underutilized. So since I talked about the strikes, and we're almost at 1, and I'm going to introduce our saving the best for last presenter. But I thought, you know what, I just want to talk a little bit about the Pharmacy Technician Code of Ethics. So let me read a little bit of this preamble, and then I just want to point out one thing to you. When we're looking at setting boundaries, it's important, I know you guys all know this, but it's important for me as a piece of this presentation to remind everyone. Pharmacy technicians are healthcare professionals who assist pharmacists in providing the best possible care for patients. A pharmacy technician's first consideration is to ensure the health and safety of the patient. We put our patients first. When you are thinking about boundaries, be a professional and always put your patients first. We need to set boundaries. We have to set boundaries. But keep in mind, Code of Ethics, I'm streaming through these. They're on the AAPT website. You can look at them there if you want to refresh your memory. And again, I just want to drive home to know your importance. We are truly doing $1 million job, and we need to have a pay scale that shows that.